Welcome, everyone. We are very excited to have you joining us as we talk about using teletherapy to bolster student mental health. We will hear a wonderful presentation by Pola Morrison, who is a school psychologist by background and a mental health specialist on our team here at eLuma. My name is Jeremy Glauser. I am the CEO and founder of eLuma. We also have John Kelly, who is a school psychologist and a wonderful advocate for wellness and mental health. This is a webinar that is part of a broader series. We'll learn more about that from John here in a couple minutes. But I'm going to walk through a little bit of an introduction with you. John will also go through and introduce a little bit as well. If you can go to the next slide, please. We'll spend some good time on the presentation, and throughout that, we encourage you to think of questions, to add those questions. As a matter of fact, if you go to the bottom of Zoom with your mouse, you'll find a little chat bubble. Click on that, and you can add your questions there. We'll keep track of those, and we will have a great conversation about the questions that you've submitted and a great discussion about all things mental health in teletherapy. If you have any, also if you want the resources, those will be distributed afterward. One other thing I should note is that there is closed captioning available. At the bottom of Zoom, there is an icon that has a CC in it. When you click on that, it will populate options for closed captioning. Let me tell you a little bit about eLuma. We're sponsoring these webinar series because we believe in the need for mental health supports throughout our K-12 schools. As a matter of fact, it's our mission to help students achieve their full potential. And this mental health solution is part of that process. So we want to provide opportunities to learn, to build community, and to help all of us join a conversation about what it means to have good mental health supports and practices in our schools. We have served over 38,000 students in 36 states, and you can engage with us on social. Our Twitter handle and our Facebook page are listed there. Please engage with us, be part of the conversation. One other thing I want to tell you about is an opportunity to get a $100 Amazon gift card. Hey, this might help with the holidays. Who knows? But if you schedule a consultation with our team, we want to give back to you, because for us, the dialogue is important. And we do believe there are ways to partner together and help your students achieve their mental health goals and their needs. So go to eluma.com/consultation and fill out the form, schedule a consultation, attend that with one of our team members, and we will happily send you a $100 Amazon gift card. Now I'm going to hand it over to John to talk through the rest of this introduction.
Thank you so much, Jeremy. It's a pleasure to be back. Welcome you all back into Office Hours with Dr. John Kelly. As Jeremy said, I am John Kelly, a school psychologist. Greetings from sunny St. Croix. I am not going to rub it in too much for all of you back up in the States dealing with the weather patterns I see that are going across the country at this point in time. But no, I am at least for the time being, coming to you from St. Croix and enjoying my time here. But these monthly webinars have become a special part of my professional career. Doing a webinar like today's and welcoming in friend Pola Morrison into the office hours is a wonderful thing. This actually closes out our fall series. It's a great way to kind of close things out as we talked about Tier 1 services and really how schools can create and address student mental health needs within the Tier 1. Later on during the winter and springtime, we're going to talk more about Tier 2 and Tier 3 services. But our guest Pola Morrison is really she's an expert in the use of virtual services. As you heard Jeremy say before, she's a member of the eLuma team. But quite honestly, and no offense to Jeremy, but she's a school psychologist. So I mean, that right there.
100%. I 100% support that. This is gonna
No,
be
all
great.
joking put aside, Pola has really helped to move the field forward in terms of using virtual services and meeting schools' needs based upon the use of virtual services. So I'm not going to spend too much more time introducing Pola. We do want to get to the conversation, but welcome to Office Hours, Pola.
Thank you. Thank you. So as John said, I've been in the trenches, so to speak, both in a on-site school as well as virtually. In fact, I was just looking at my records. I started a hybrid model of virtual back in 2006. So although virtual school psych, virtual mental health may sound new to a lot of people, it's been around for quite a long time. And so we're going to look at some of the research and what we found, especially during COVID. We'll look at a little bit at what we learned and common experiences. So part of my role now is I speak to a lot of clinicians out there, school psychs, LPCs, counselors, just all areas of counseling, and we all have the same common takeaways. We'll talk about how the industry has had to rethink mental health and how our delivery models had to change. And then we'll talk about using our platform to really advocate for equity and diversity in the mental health area, and then looking at the technology and the emerging technology. So there's lots of ground to cover. Let's get started. So one thing, I think it was last semester, Dr. Eklund from the School Mental Health Collaborative did a webinar on universal screenings. And in the last school mental health conference, which, you know, if you didn't attend, I think you can still have access to it, purchase access to it. There were some great sessions, and one of them in the creative counseling session brought up this research study back in 2015. This is way before COVID, that at the time, 92% of students went online every day. And so school counselors could find a way to interact with them very easily in a virtual environment, more so than a brick and mortar school. So they were very intuitive learners to the virtual environment. That shows us that this generation has that experience, has the know-how, the ability to really utilize the virtual environment. And in this study, utilizing cognitive behavioral therapy, this was a very focused and perhaps, you know, outside of tier one, but there's something about this study that was very interesting because it outlined how the pandemic really made us rethink mental health. It really made us look at what was happening before and what happened during. So there was a shortage of therapists before COVID, and then no services. And as we return, there's still that shortage. But one thing we did learn during COVID is that the virtual environment allowed us to access students who didn't have access before. It broke down some barriers. This research looked at students who may not have had the transportation, may not have had the on-site mental health, but because virtual therapy came into play, they suddenly had these opportunities. So it looked at how it broke down the barriers, and it looked at the success of a specific type of therapy with these students. And then finally, in the qualitative one, that one looked strategically at a demographic in South Carolina. And what was interesting about this study was that it looked at 7 different areas across the state. And one thing they found is that this population moved from place to place during and post-COVID. They were able to have continuity of services in a virtual environment. So because the schools were connected, if a student maybe was living in one town and had to move to another town for economic reasons, they could still access those services. And it really did break down the barriers for the student population. And again, it also cited the importance of using cognitive behavioral therapy. So there's a couple of things that maybe school sites or school psychs specifically are having to revisit when we're looking at our counseling program. But overall, they're looking at how virtual platforms really did help access therapy services. Now, for those of you who were involved in virtual environments, everybody who had to work from home during that time, we all had some lessons. We all had some discoveries to make. And we remember that meme of that professional who was working and his family comes in behind him. This is way before Zoom uploaded virtual environments, and there's the Zoom bombing, all of that. So the virtual environment back in 2019 is very different from the virtual environment today. But we did all have to troubleshoot during COVID. Families working from home, teachers, administrators, counselors, speech and light, all of us had to troubleshoot. We had the same issues. We were trying to figure out how to engage with our students. We were battling with bandwidth and the Wi-Fi access. We were battling digital assets and how do we get a signature on a form? Do the parents come to the school? We were all trying to figure this out and trying to maintain the FERPA and the HIPAA compliance and the confidentiality issues. And so as we're figuring this out, we were all learning together and the industry was moving forward. The necessity really moved the innovation. And that is where we're seeing the growth today. So we've had to really rethink mental health services. We had to rethink how can we reach out to those students. And most importantly, we have the students who are on the school site, but what happened to the students who were homeless, or the students who were in a shelter, students who didn't have access to technology? We had to, as a school and an administrator, we had to really look at how we could make that accessible. And boy, there were some really interesting ways to do that. What we did learn was that one program did not fit all. And because of where I'm at now, I work with clinicians all across the United States. And what worked in California doesn't work in Georgia. What works in Georgia may not work in Tennessee. The strategies and the way we access virtual was different. The types of therapies were different. And so even though there were differences among school sites and districts, what did help was that the virtual platform made it equitable, made everyone could have access if they needed access. And by being at the school site, they could have that access. Some communities banded together and had pods where they had access. Some libraries were open at certain hours and had access. So we had to figure out how we can make this platform equitable for everyone. And the other thing we learned from COVID was the tremendous need for wellness, not only during, but also after. And if you remember, there was a popular, on the internet, there was a popular show, I guess it was called, trying to really bring wellness to the forefront by good things, thinking about all the good things in the world and presenting about the good things. And that was kind of what we needed at the time. And now coming back with teachers stressed and burdened, we need to think of the good things, and we need to rethink how to present those good things and how to work with those good things. During the remote environment, we had to come up with contingency plans. And so I was at the time working with a district that did, it was in a geographical area where there are no tornadoes, there are no hurricanes, there's no snow days, it's beautiful weather every day. So having to go into virtual or digital learning was new, and they didn't have any contingency plans like maybe the state of Idaho or Montana might have. If there's a snow day, XYZ will happen. If there's a natural disaster, XYZ will happen. And so districts really had to look at contingency plans for digital learning. And that's something that has evolved and grown and actually really secured not only mental health services, but academic services, so that everybody knows what our plan B is if we can't come to school that day. One question I get asked often is what happens in a virtual environment when there's an emergency, when you're concerned for a student's well-being? And that's where this has to come into play. So that's one of the differences in COVID. It's like from one day to the next, we're all online. Everybody jump online, just get on this Google Meet or this Zoom. We're just gonna figure it out. Now we've had some experience and we've had some lessons learned where, okay, we're going to plan for this virtual therapy session or service, we're going to make sure we have our training. We're going to make sure we have our emergency plan. So there's a contact person if something happens. I talked about the homeless population and working with shelters. And I was working with a school in California, and there were areas identified that had very minimal bandwidth or Wi-Fi. And so cities began their initiative to start providing Wi-Fi services at a broader geographical area. And that was about the connectivity. They realized it wasn't just about the academics. It was about the wellness. It was about being connected and feeling connected. And so that was addressed within cities. And then again, the continuity of service going from place to place. You know, we've all worked in district, or some of us have worked in districts where there is a student who just kind of migrates in this area and goes from school to school, and you feel like you're starting over all the time. Well, that's the beauty of the virtual platform, is that if you know who you're, you know, if the school has the program, then that same counselor can reach that student wherever they're at, whether they're at XYZ school or they move to AB school. Those can continue and regardless of where they've moved to. And the other thing that's happened too during COVID was there was funding provided in the telehealth and telemed environments, and that expanded to education. And there was a time frame when funding was provided for therapy. Well, fortunately, because of the great work, the advocacy work, with the funding opportunities, I think it's the Bipartisan Safer Communities Act, that has expanded to access services through telehealth. And we had this webinar earlier, I think, John, that you spoke to about Medicaid and education. And so those have been really have come to the forefront because of COVID, and during COVID that the need was there, and the funding is now emerging. And I think that the growth of teletherapy will be there. Let's see. So this is one of my favorite quotes. So when I was a newly minted school psych, I had a mentor that helped me overcome my new challenges in my position and my role. And he never saw things as difficult or a challenge or obstacles. He saw them as opportunities. And he said, you can't just be doing the same thing over and over again. You got to think about what comes next. And I love this quote, where we have to rise to the next level. And so I mentioned earlier, pre-COVID, we knew we had shortages. We were just trying to keep up, trying to be creative and find ways to address more people, more children, or provide services at a greater level, provide more services in the classroom, but we were already spread pretty thin. COVID comes and then there's nothing, and it's, you know, we're all trying to learn and address what we can when we can, and hopefully we can catch up later. And we didn't really have a strong timeline. There was a lot of direction. And now coming back, we immediately saw the strain and the stress and the anxiety and all the issues that came from coming out of COVID. And so we are at that next level. This is the next level. And so we have to come up with these new solutions. And last week, Jeremy talked about the different virtual models. We talked about the hybrid and the traditional models. So I was working in I was as a remote school site 2006, and it would be considered more of that hybrid model. And now that was before virtual platforms. So I would go and see a student in person and then follow up conference calls. And that was continued. All the meetings were all conference calls. And now today the comparable would be a virtual. And so there are some situations where maybe the clinician has that introductory session or that intro, that first step, and then follow up with virtual. And then there's a traditional where, you know, there's another person on the site. I've done both, and I found that the clinicians and myself found a very unique perk or success about that situation. The one thing that happened not only during COVID and now in the virtual environment is that there is a far greater parent or family impact. And those research studies earlier focused on how it was a family telehealth service, because the students were at home, and during COVID, the students were at home. We were working with families. And sometimes some schools need that next level. We have to work with families and collaborate with families. And because it's virtual and parents or caregivers don't have to take time off of work to drive somewhere and get back, they can call in or do the virtual platforms from wherever they are. Or if it's, after the school day, it's accessible to them and there's far more buy-in. So these hybrid and these traditional models, may look a little different per site, but the one common factor we're seeing and hearing is the parent input or the caregiver input, the accessibility to families, and then the accessibilities to the staff at the school. The emerging tech. So we talked about what Zoom looked like or Google Meet looked like in 2019, and then some people were being Zoom bombed, or there were some unexpected visitors, and sometimes there were not enough Wi-Fi, not enough bandwidth. Sometimes engagement was an issue. People were concerned about FERPA, but now with the new platforms, especially Zoom, we're finding that the security is there and the engagement is growing. And so the technology, not only accessing platforms on a phone, a tablet, a Chromebook, or a computer is available, but the content is just booming. The content for engaging with younger children or with high school students. The curriculum is just building. We see it with not only our OTs and speech and language, but especially with our counselors, and the creativity is just amazing. I've seen therapists utilizing green screens, creating virtual therapy rooms, creating games that are interactive. We have really started to go to that next level when it comes to mental health curriculum. And then keeping in mind that cognitive behavioral therapy, or CBT, is kind of been the one that seems the most effective in a virtual environment. We're seeing clinicians kind of utilizing and structuring their engagement activities more towards that. And the one thing that was a common issue that came up pre-COVID or during COVID was the training or lack of training. A lot of it was hands-on, trial and error, and now there's more specific training, not only for utilizing a platform, but for actually providing telepractice or teletherapy. When we were at NASP last year, we had several universities there presenting their research on not only the field, but in teletherapy. That is the one thing that they were really interested in, is in incorporating training for the up and coming counselors and psychologists, that it needs to be a part of that curriculum. That's something that we provide our clinicians. We have some training for our platform, but that's something that we are working towards delivering next semester, is our telepractice boot camp. And so that, I think, is that part of digital literacy that is so important, that we are starting to recognize that not only do our students need to have a level of digital literacy, but so do our staff, and so do our providers. And so training is emerging, the curriculum is emerging, and then the technology. One thing I want to add to the technology is recently, I think that some of the iOS platforms are actually looking at adding your cell phones as another camera. And so that's probably come from the use of academic remote and teletherapy, as well as the use of VR. So virtual reality for patients in the medical field has been going on for a few years now, especially for TBI. But most recently, that's moved on into treatment of anxiety and depression in adults. And as we've learned in this field, a lot of the tools and and technology that comes to schools often starts with the adults. And so I wouldn't doubt that some of it starts to move into the K-12 environment. And so VR is also emerging in the field of therapy and as well as in the medical area. Okay, so that leaves us some time for discussion.
So much there, Paula. I'm not sure exactly where to
Yeah.
start, to be very
I
honest
know.
with you.
There is a lot.
You caught me mid-thought as you were talking about, we really can't be looking at resolving issues by the way we created them. We really need to be looking at new ways and new solutions. And forgive me, I'm going to start off the conversation with a bit of a confession. This is true confession time, and kind of a little transparency on my own part. So anyone who knows me knows that I have been the biggest advocate for mental health services within the schools. I call it my soapbox issue. I've been talking about it for feels like decades, probably has been, but who's counting? I believe that the provision of these services within the schools are so vital, and for us to really embrace that role, because we won't get to the research, but the research is clear. When we provide these services, it not only benefits the kids in terms of their social emotional adjustment, but it actually benefits them educationally as well. We had Shauna Rader Kelly on a little bit earlier in the series. We had Maurice Elias last month talking about social emotional learning and the benefits that are certainly there. So I've been advocating for these services for a very long time, but you know what kept coming up? The number one reason why we often can't provide these services is because we don't have the providers. There's such severe shortages across the nation.
Yes.
In school psychology, in social work, in school counselors. And so, in fact, it's the number one issue that the National Association of School Psychologists is really trying to address, is the shortages. There's 5 major goals, but the shortages is the major kind of overarching goal that is out there. Because we realize that you can have lots of other goals, you can have the best intentions, if you don't have the personnel. And probably I would say to you, here's the true confession, that the prior to the pandemic, I was definitely on the side of, I'm advocating for in-person services. I'm advocating for hire more school psychologists, get those social workers on board. And while I still think that that's important, the reality is that's not the solution at hand right now. And the pandemic really proved that to me, and I think to a lot of people, and you brought it out here. What has really changed? And so what have we learned? We've learned that virtual services can be the answer, particularly for districts that don't have the resources, that don't have the personnel to provide these services. And go ahead, Jeremy. I just think that's so important.
I agree. And I appreciate your confession. I think we've all been there. For me, it was about 12 years ago, and I was a naysayer, a doubter, and now I believe that a hybrid workforce really is a better workforce in this environment. So I want to ask a hard question of this group right here, and is teletherapy really the best modality for every student?
That's a great question, and I think I'm gonna refer back to what John was mentioning about the shortages, and then I'll get to that statement.
Yeah, please do.
The shortages, absolutely, and what I find, and I want to just mention the psych pack that's being worked on to try and help alleviate some of these shortages. Although there are cross packs for other disciplines, speech and OT and the APA for clinical psych, school psych is still waiting to get the psych pack initiated and moving to help alleviate that. But what we're finding too is that it's not a one size fit all, and it should be, we need to look at various solutions to help provide services. And I often refer to teachers, because teachers are so amazing and resourceful. They will pick what they know works best for their student, whether it's this math program and a little bit of sprinkling of this, and maybe I've got this special game here. And, you know, they pick and choose what's going to work for that student, because students are so individual that schools almost need to have that mindset. I got to pick what's going to work the best for my demographic or my school. And in teletherapy, we're one of those options. I'll give the example. So I typically have worked in low socioeconomic, multilingual, very diverse populations. I'm a bilingual psych, and oftentimes I'm the only Spanish-speaking psych in the district. And so let's say the school has 2 or 3 students in Spanish only, but my assignment is 30 minutes across town. For me to get over there, I've got to give up the 3 days I was assigned at my school. My school's got to be without for me to do that. But with flexibility of a teletherapy or telehealth, let's say a school says, you know, I really need my bilingual psych where she's at, but I need somebody to help cover this little bit of assignment over here. And so that could be that flexibility of my needs are here. I need to utilize some teletherapy services there. Or I was at a predominantly African-American school, working with a lot of foster placement, correctional facility families, and grandma says, I like how you work, you're doing great. I don't want to insult you, but my grandson needs to speak with a male, a Black male, please. And I totally get that. I was the only, in my district, there were mostly women, not a lot of men, school psychs or counselors, but by utilizing teletherapy, we could, you know, specifically find the right counselor for that demographic. Ended up taking a group because she was voicing the concern, and the need was really greater than just her grandson. It was many grandsons and sons that needed that kind of that link. And so I think if you look at what your school's need is, sometimes you need to pick a little bit of this and a little bit of that. I need some on-site here, or my facility is multiple disabilities, you know, physical, they need that on-site there. But my other site, we've got lots of therapy family issues who need maybe some support after school, maybe some LCSW level support. I can't find anybody who will drive to my district to do it. So teletherapy can fulfill that. So I think it's that whole one size doesn't fit all, and we're an option. Teletherapy is an option.
Yeah, I love how you put that, Pola, because Jeremy, I really appreciate the question. Is it right for everyone? And you know, I just to kind of throw my 2 cents in there, I would agree that it needs to be an option that's out there. I will say that each school district knows what's right for them. I think it's really dangerous for us to come in and say, you know, one size will fit all, or this program is the best for all school districts, because I think many school districts really need to determine what their needs are, and then create programs based upon what their needs are. I think, and I'm living it now, kind of what you were describing, Pola. Part of the reason why, I know I joke a lot about being on St. Croix right now, but part of the reason why I'm here is because they have such significant shortages of mental health services. And I was asked to come down to try and help and create some programs and support some of the schools. And while I'm here on site, we have school psychologists who are working virtually with portions of the island, because without that, those portions of the island simply were not getting service. And that's the reality, is that when a district or an area is just simply not able to get service, it's not good enough to say, well, we just don't have the people. We don't have the professionals to service them. And so times like that, I think it's really critical. I want to shift, if I can, just for a moment, because I want to be really careful here. Oftentimes we talk about teleservices or virtual services. We focus on tier 3, those intensive services, teletherapy. And we're getting sucked into a little bit here. So I want to shift us just a moment, because we're really talking about tier 1 services. Yes. When was the last time you heard anyone talk about virtual services at a tier 1 level, kind of those universal services? Yes. And so, you know, Paula, we've been talking to previous guests about, you know, how schools can meet those tier 1 services. And I'm just wondering if you have thoughts on that. And I want to cue you, if you could, talk maybe about some of the virtual rooms that you were talking about before, and how we're creating these virtual rooms for all kids. But please, love to
Yes,
hear your
yes.
thoughts on that.
Oh, absolutely. So, to reference where you were at, some services are no services. We know what happens when there's no services, right? So teletherapy is definitely that option to have. Tier 1, we talk a lot about tier 1. In fact, when I was at NASP last year, there was a great research. I wish I had it up with me, but it had to do with classroom-based SEL. And so it was a group of school psychologists who, I think it was 6 different schools, interviewed with the teacher, what were their emerging issues in their classroom in the SEL, and just trying to get information about how they could best support. But after that point, it was all virtual and it was all coaching. And so they did kind of a professional development on classroom CBT, cognitive behavioral therapy strategies within the classroom as a tier 1, so that the teachers could understand, the references and the lingo and the purposes of the activities. And then they trained them virtually. Then the teachers video recorded the activities and then sent it back to the psychs. And then the psychs would comment, hey, yeah, this is great. Oh, Johnny's doing awesome. And so as if the psych were in the classroom observing and taking notes, the psych was observing the recordings. And this was a research study. It was somewhere in the Midwest, and it was hugely successful. And so teachers need that support and want that support. But it's not the canned support. Like, here's this curriculum, take this in your classroom and use it. They want it to be individualized and customized. And that's where maybe you don't have the school psych on site to spend that time with you, but you have them virtually to coach you through it and consult and collaborate in that tier 1. That's one instance that comes to mind right away. The other is in one of those studies on trauma informed and I think it was anxiety or post-traumatic stress therapy. Not to reference that, I know it's not tier 1, but how they initiated it was through telehealth outreach. And they created an outreach team where all students in the tier 1, the classroom, who were at risk were from the ACEs inventory at risk, demonstrating at-risk behaviors. When the MTSS team had them in that tier 1 and referred them for at-risk, the telehealth team outreached to the family and the parents, the students. So it was like, let's make that contact. Where are the issues? Where can we support? Do we need some explicit SEL training in the classroom? I think it was Dr. Elias that talked about that, one of them. Do we need to go and maybe create some lesson plans, and then let's do it one-on-one, a check-in with our outreach student, and then incorporate that in the classroom. So let's say Johnny is having a hard time. I'll choose something super simple. Please and thank you, something easy. We have a lesson with a story, a game, an activity, one-on-one, and then we collaborate with the teacher and say, okay, now we're gonna put that in the classroom for everybody to have an activity on, please and thank you. And so collaborating that way and using that telehealth outreach to provide those very explicit SEL skills is another one of those tier 1 strategies. And we see that in the virtual classrooms. And basically there's, it just blows my mind that there are these tech savvy counselors and psychologists out there who create these slides with their avatars. And if you click on this button, it opens up the door with a question. And for us old schoolers, it used to be a form where you would give the student, okay, finish the sentence, and then they'd have to sentence completion, right? Or draw a picture of your family. Now it's all virtual. And so let's say they click on this little cabinet, it opens where, tell me something that you did that made you happy. It would be those kinds of school psych questions, activities, guised in a very game-like way. And sometimes they're Jeopardy for the whole classroom. Like everybody's going to do social skills Jeopardy on the classroom, or it's that outreach where that person is at risk or transfer back. Maybe there's a general ed student who, I'll pick someone older, so maybe middle school or high school. Maybe someone has been released from an overnight in a residential and needs that outreach. That's where this continuity of service, or they're going to have that outreach every week as they transition back from a very rigid environment to a more open, flexible environment. So that, there are some great screening tools and universal tools that Dr. Eklund in her previous webinar has, and the School Mental Health Collaborative have, that can be used in a virtual environment. It's just about rethinking those tools. That's part of what our team does too.
Yeah, I think that's really great. And at least with eLuma and virtual services, I'm going to list off all the tier 1 activities that a virtual school psychologist, licensed clinical social worker, school counselor, or LPC can do in conjunction with the district. And that's the universal guidance or SEL lessons, like Pola was talking about, universal screeners, risk and threat assessments, staff mental health counseling. Oftentimes we don't think about our staff. That also can be conjoined with the staff professional development, as well as caregiver support and training, right? We have caregivers, parents, and guardians who need some of those support systems. School-wide wellness campaigns, involving those professionals into those campaigns, making sure that they're involved in that referral process when a student does need tier 2, because schools, we should have those monitoring and referral processes if we're going to do universal screeners to identify additional interventions. So these are some of the very specific activities that a virtual provider can and may support a district in doing at tier 1. And then, of course, there's so much that comes before we can effectively provide mental health and MTSS, right? It's the needs assessment and consulting that comes beforehand. And there are many great remote or virtual providers who are equipped and capable of helping districts do an assessment and establish policies and procedures that will really be the foundation of our MTSS framework around mental health.
Thank you, Jeremy, for kind of bringing that in, and Pola certainly for talking about that, because the message that I want colleagues to hear is that, again, when we talk about tier 1 services, we're talking about those universal services. And yet, in my experience, one of the biggest barriers to really implementing quality tier 1 services, whether it be social emotional learning or some other type of service, is oftentimes a teacher. My teacher colleagues will say, well, John, I'm not trained in mental health, or John, I don't know how to do that. I'm not comfortable with that. And so I always fall back upon my role as a school psychologist, or certainly my social work colleagues or school counselor colleagues. We engage in this consultative process. And so we consult with our teacher colleagues. And both Pola and Jeremy, you just kind of described, how the teleservices, these virtual supports could serve in that consultation role for our teacher colleagues, helping them to set up those programs, individualize it for their classroom, rather than just a package deal. Okay, everyone's going to do this. So I want to reinforce those messages, because again, as we focus on tier 1, it's really important to recognize, these virtual services can fill a need when you don't have the professional resources that are there readily available within your community. I think that's critical. Pola, you made reference, and Jeremy, I'm going to put you on the spot here for just a moment to, for some folks may not have been aware that you gave a webinar last week, and
Right.
Pola, you referenced how you talked about kind of different models, and Jeremy, can you give us a kind of a quick recap, because I think that's important for people to realize. We used to think about one kind of traditional model of virtual services, but the reality is that we've kind of advanced beyond the old traditional models. Would you mind just sharing that briefly?
I wouldn't mind at all. I think that's a good point. And traditional model means that the provider covers all the job responsibilities within the job description. And a virtual service provider can do that. But not all districts need that, or it's not the best option for all districts or even all students. So the other really time-tested models would be a tandem model, which is taking a building where you have an on-site provider already there and ingrained into the building culture and into the team, but doesn't have the capacity to serve all the needs. So you partner in tandem with a virtual provider to build capacity. And that can be dividing by responsibility. So one does assessments, one does other activities, or any other mixing and matching of how those two providers would work best in tandem. The other model that we like to talk about is a supervisory model. And we know that up and coming professionals are part of the pipeline that we need to fully staff schools. And there are those who are going through their programs and need hours toward their master's or their credential. We know that there are others who just need supervision to provide the work or do the work that they provide. So a supervisory model is a third option that schools can use effectively.
I appreciate that because, as I thought about it, quite honestly, I think more than I think many of us realize are really engaging in what I would call the hybrid model. Where we even ourselves, and myself included, the amount of professional development I'm doing online now is
Right.
far greater than I did 5 years ago.
Right.
The amount of meetings that I'm attending, I have a meeting, on one end of St. Croix, and I'm on the other end of St. Croix, and I'm not, able to travel across the island.
Look at us now, John. Although I would love to come to you in St. Croix, and I'm sure we could convince a lot of people to come, very, very few would be able to manage the travel, right? And we're living in a hybrid workplace already.
Yes.
Our workplace is hybrid. Our workforce is catching up. And we'll get there. We are getting there. It's just a matter of doing it with best practices and research-based and evidence-based.
Right.
And that's whereas a school system in this country, we're leveling up. And it's exciting to see because hybrid is not the silver, it's the shiny solution that solves all problems. It's one.
Right.
We have to address the pipeline from higher ed to classroom. We got to stop the leaking bucket of attrition of teachers and professionals in our schools. There are different stages along the continuum of work that we have to address, but one that we can implement now is a hybrid workforce as we continue to address the other stages of that funnel.
Now, thank you for acknowledging that. I think that's a really critical acknowledgement, and hopefully resonates with the folks that are joining us today.
Hopefully.
Yeah. Pola, if I want to come back, I hopefully we've convinced folks that this is an important model to be considering. How can we advocate for school mental and behavioral health services at this point in time? It's such a critical piece of the puzzle. Advocacy. So we'd love to get your thoughts on that.
Yeah. Well, you were mentioning before that you are attending far more meetings than you ever did before. And I find that true for anyone working remotely because you're accessible, you're available, people can reach out to you. And so any school with an MTSS framework and knowing that their school psychs are the resource library of evidence-based interventions and accommodations, who wouldn't love a school psych attending the Tier 1 MTSS meeting for at-risk students instead of waiting till Tier 3 that then the school psych might show up to provide you with some support and collaboration? But it's the availability. Sometimes the ideas that we come up with as school psychs or the accommodations or interventions are suitable for all students. They don't have to be in Tier 3. They can be in Tier 1. And I remember training classroom teachers at tier 1 on how to implement the ABC chart, for observing behaviors, and using the FAST forms for and the motivation scales when we were dealing with behavior plans. And yes, a student can have a behavior intervention plan in tier 1, and you shouldn't have to wait to get to tier 3 for that intervention plan. But it's because we are stretched so thin that we can only go to the fires and not the preventative work. And so teletherapy or tele-health can give you that access very early on in tier 1 and work on the prevention and intervention before it gets too caught up. But as far as advocacy, I have found, because I'm a boots on the ground, working in the trenches person, that I'm speaking with the clinicians. I'm speaking with the people who are out there in the classrooms, and I've spoken with counselors in the schools. And one thing that just resonated with me, we were at ASCA this year, and the power and the influence that counselors and psychs have at their school site, I think is underestimated. Because I was just talking to a principal, and she's like, well, if my teachers want that, I'm going to get that from my teachers. If my psych says I need to buy this test to help my ESL student, I'm going to get that test. I think that as people who are working in the trenches, working with the students, we know the needs far better than anybody else. We know what our school site needs. We just need to be aware of what's out there. And so it's new to a lot of counselors that they were like, what? You have virtual counselors? I could really use some help on my site. I already have a waiting list 6 weeks long. I'm packed, and they're not going to hire more counselors, but I would love to have somebody do my weekly check-ins for the kids that are just on tier 1. I want to, but I had no idea. I need to get back to my administrator about this option, and it's really spreading the awareness that it is an option and it's a viable one. And I think that as people who are working in the school sites, they see the day-to-day, they see the need, they know how overwhelmed or overtaxed everybody is, that they can make that mention. They have an influence with the stakeholder who are making that decision. So I think that advocacy really starts at the grassroots level. That's my opinion.
Can I tell you how much I love that answer? and Jeremy, I'm going to come to you in a minute, because I know advocacy is a kind of
100%. I know Paul is right. That's where it all happens.
But so many of us, we talk about advocacy, we think about going to Capitol Hill or going to our state capitals and advocating on that level. And for years I have been saying to folks, you know what, advocacy happens just every day in our jobs. Sometimes just the way we do our jobs is advocacy. So I love that you said that. But Jeremy, I do want to come to you, because I know advocacy is a passion for you. I know you attended some advocacy training over the summer. You really have become a leader within the field. So I'd love to ask you, how can we advocate from your perspective for these mental health services?
Exactly what Pola said. Pola, it's spot on. Spread the awareness, help educate, bring up solutions, right? Do our own research. In addition to that, I think it starts with our own self. And if we're not advocating for ourselves through daily healthy habits, then it's going to be very hard to advocate for others. And from there, to me, it just builds out. It's my family, it's my community. And on a national level, there are many easy ways to participate in advocacy. And George, if maybe what you could do for us and put a link in the chat to the case link on their website to where people can go and contact their local House rep and their senator. But CASE has made it really easy for us. There are issues and briefs, and then it's as easy as clicking a few buttons and filling out some information. And that sends an email to our local House rep and our senators so that they know what we care about as constituents. So that would be an actionable resource. And we'll work on getting a link to that here in the chat for people.
Yeah, give me a second and I'll have it pulled up.
No, I appreciate that. Thank you, George. And I'm going to pop in a similar link for the National Association of School Psychologists who have done similar. So we'll put those links in for folks. We're coming quickly to the end of our hour. I say this each and every webinar. It just goes by so quickly. But I'm going to ask actually the both of you, if you don't mind, to kind of look to the future. Let's look forward a bit here, because we realize we really are kind of at without sounding overly dramatic, at the dawning of something very, very new. And so I'm wondering, where do you see teletherapy, these virtual services going in the next 5 years, 10 years? First, I'll ask Pola, and then Jeremy, I'd love to get your thoughts on it as well.
Well, I think the technology will definitely improve or just kind of expand. I think what's available to us now, the virtual platform we know now is emerging and growing. I think that virtual reality is coming in some capacity, as well as gaming for mental health purposes is coming. But I think for those who are in training and going to in university programs, or even those who are new to teletherapy, I think that it's going to be the training. I think that it's not just to jump in and do it. Just, a lot of people think, well, I'll just go online and do it. I think there are a lot of nuances and a lot of practicalities and legal considerations to be considered, to be thought of. And so I think that telepractice training is going to be something we're going to see not only in the practice, but in the university level. I met with a few professors who are like, I know that this is the next door for our students. They need to be well versed on it. So I'm looking at how am I going to incorporate this in my coursework. For us, we are launching a telepractice bootcamp next semester because the need is there. There are a lot of people who want to practice through telehealth, a little frightened, but it's a little more than just signing on to your link. Right. It's a little more than knowing how to administer a Woodcock Johnson. It's just, there's a lot of other things to take in consideration that require training. And then lastly, I think that overall the school environment is going to change and will incorporate one virtual aspect or another. There will be something virtual, whether it's going to be the wellness checks at Tier 1 for the school wellness, or if it's going to be the 504s or some, it's just, I think every school, if they haven't already, will have a virtual component to it.
Yeah, I agree with everything you said. I break it down in near term and long term. And near term, we are in a pressure cooker because funding that has been given and has an expiration needs to be allocated. And so programming to get funding is a very near-term thing that districts are solving for, because mental health is part of MTSS. It's no longer, oh, the healthcare system will address that. No. People are no longer saying that. People are understanding that that schools are almost the battlefront, so to speak, and that pressure to allocate funds will cause change. Longer term, Medicaid is a sustainable resource. I think we need to be looking really deeply at our Medicaid rules and regs and access to those funds for mental health in particular across all the tiers. But long term, I really see that this is a hybrid solution. I see us attracting more professionals into this space by elevating the profession, by talking positively about it, by celebrating the impact that people can have as they go into these serving professions. So there's a lot of work to be done in the long term, and I'm excited for it because I feel like for the first time in this country's history, there's actual momentum.
Agreed.
And as what a great way to kind of close things for today, as a professional working in the field for many, many years, I'm grateful for the both of you as advocates for this, and certainly your leadership in this branch of the field, because I do agree with everything that both of you just offered there as the future and what we're likely to see down the line. I think training is going to be virtual. I think, Pola, you are absolutely correct, and helping people understand really how to use this and best practices within the field is going to be critical. Jeremy, I really appreciate you bringing up the funding issue. And I'll just reference folks back to a conversation we had with Dr. Kelly Valancourt Strobach in September, where she talked about exactly what Jeremy was just saying, the funding issues and the funding that's available right now, currently available right now for school districts to be funding these types of services. So if anyone is kind of questioning or wondering what we're talking about, go back and watch that webinar, the conversation we had with Kelly Strobach.